All right, guys. So we are live, episode 2 of the IoMT show. Here. First of all, I want to thank my guest, Austin Weaver, for joining me. Austin, you can correct me if I'm wrong, but you are the VP of Network Innovation at OptumCare, which is a branch of United Health Group.
All of those are true things. Yes.
Okay, good. Got it down. Awesome. Well, I'll kind of give you the floor. Tell us kind of what you do with OptumCare, and then we can kind of dive into it. So.
Yeah. So at OptumCare, which is its provider arm of the Optum universe. So Optum is a large organization that provides medical care services, pharmacy benefits management, all sorts of things to the healthcare industry. And OptumCare happens to be the largest provider organization in the country, with close to 60,000 doctors, hundreds of ASCs and urgent cares, kind of all working together to kind of push a value-based agenda all over the country. And I lead our national payer strategy work, which means I have to partner with the different health plans and figure out how we can work with them to just grow our business. And that often means pushing really innovative programs with them and trying to take healthcare into the future. And so it's been a really rewarding time. It comes from a long background of consulting that I did prior to this role. And in about 10 days, I'll be taking a new role with a company called Hinge Health, which provides telemedicine services for musculoskeletal issues, and kind of the next, I think, big thing that's hitting the healthcare industry right now. So I can kind of speak to both capacities as valuable.
Awesome. Well, congratulations. That's awesome. Obviously, another step up in your career, I'm assuming.
Yeah. Oh, yeah. Yeah. This is
Awesome.
it'll be very fast pace, lots of pressure. Hopefully, we can build out a business that continues to serve a bigger and bigger set of the population. Because if the COVID issue has taught us anything, it's the need to change the way that we connect with folks that are suffering from different conditions. And I think certainly the opioid epidemic and a lot of the behavioral health issues that we've seen, not being physically capable is a really big issue, and one that needs to have a virtual component for the way that we consume our healthcare in the future. So I think we'll do a lot of meaningful stuff. It'll be fast paced and crazy. Going from an organization of 330,000 people that I'm a part of right now to something that is your classic West Coast tech startup is going to be a change, but it'll be a really good one, I think, for us and my family.
Awesome. Well, congratulations again. So going back a couple minutes ago, you mentioned innovation in the healthcare space. What have you seen innovation-wise, and how does that kind of play into your new role starting? I mean, you mentioned innovation and then telemedicine.
Yeah, so. and there's a connection point between kind of all the work that I've been doing really over the past 15 years in healthcare, and that is there's a continued shift to ambulatory care. So the idea that we need to go into a single big facility to consume the different healthcare services that we need, I think, is an aging out model, and the influence of the actual consumer is starting to change quite a bit. And so you're seeing a lot of pressure for health plans, providers, and really everyone in the industry to see, how do I connect with the new generation that's more technologically savvy and prefers to do things differently. They want to know new information. They want to do things more on demand. They are not going to be satisfied with the way that they're doing, especially not for the costs that they're doing it at. And so there's innovation on the how do we structure actually like the insurance itself and the common model of care, which is a lot of the stuff that I've been doing recently. And then as I move into the next model, it's how do we just virtually provide services. And for us at Hinge Health, it's going to mean we're going to be providing a technology that a patient can have in their house. They'll have an iPad, they'll have straps and monitors and things, and they'll have a platform on which they can engage with coaches and clinicians to actually perform the exercises and care that they need, thousands of miles away from each other, as it were, and really have a similar experience. So I think that's a very positive innovation in my opinion.
Awesome. And do you see that trend to continue in this way of, old school versus new school, whereas new school is starting to grow? Do you really see that coming up in the next year, 2 years, 3 years?
It's been talked about for the better part of a decade, and COVID changed everything. An organization as large as OptumCare, I think we were in the single thousands in terms of telehealth visits over the prior year or something of that sort, like a very, very low number. And within a month, I think we had provided over 1 million visits remotely, and with kind of the government supporting that, at least temporarily, and organizations building out capabilities to serve in that capacity, there's certainly no anticipation of that slowing down. So we basically had a watershed moment in which a lot of virtual care and a new type of consumer experience for what we've called a patient in the past is really, I think, going to take off and isn't going to look back.
Yeah. So
especially if we can continue to pay for it. I mean, and that's been the thing that's been the slowest part. I think the technology and stuff has been there, but there was never a moment in which you could, honestly get covered and fund your operating expenses for this thing, because just the payment model had been slow to move, and I think we're seeing that broken up a little bit right now.
Yeah. So COVID definitely expedited the process a little bit, whether that's good or bad, but you certainly seeing it moving much quicker now, correct?
Yeah. It just unlocked, it opened the door. The pressure was mounting and it opened the door. Yeah.
Okay. Awesome.
And it's not going to get shut.
Yeah. All right. Well, that's awesome. I guess really any other, things you'll be doing with Hinge that's kind of on the telehealth side that you can share with, or any other kind of insights as we move forward that you see happening, in the next couple of years?
I think that just the integration to all of our common technologies. So the idea that the thing that I have on my phone can be connected in a secure manner to the information that they have about me in a medical record, to a communication platform in which I can communicate in a way that I would with a friend. And I can have a real experience of my care that continues to inform me about the things that I need to be doing, because often the medical insight is asymmetric, to where the doctor's kind of knowing everything. They're telling you a little bit, but you really don't know kind of where you're headed with all of this. You're just sort of trusting the guidance there. And I think the more empowered that we have, the more that we empower and make it natural in the way in which lives are lived, I think that's going to, add on and continue to spur innovation.
Awesome. Well, I guess, I still got you. Anything else you can share in regards to the industry, what you've seen from, when you started in consulting to your time with OptumCare to, what you're seeing? It's kind of a springboard off my last question, but any kind of last insider information you can share before we hop off here?
I think that you'll just see more specific health conditions being addressed. I don't think it's going to be these broad-based platforms. I think you're going to see innovation around being able to monitor very specific things about a person's health status. And you'll have, at Hinge, we're going to be doing musculoskeletal issues, but you have other places that have done specific diabetes issues or cardiovascular items. And each of these different health issues is going to start fitting in to the natural fabric. And you're seeing Apple put EKGs onto its watch. You're going to have an oximeter that is also a part of natural devices that you have. And so I would expect a lot of issues, if you don't see a way to handle that in a more technologically advanced way right now, the innovation is
See, I believe we lost Austin there for a sec. Let's pause, and then hopefully we'll rejoin Austin here in a second. Cool. All right, so we are back. Sorry about that. I just mentioned that we may have lost you, but we got you back. Sorry,
Yeah, no, sorry.
Mid chat, but the floor is yours again, Austin.
And I think I highlighted one of the other pieces that we didn't talk about is just the increased speed and broadband connection that we're all going to start to see, and obviously the Wi-Fi in my house just blinked for a second. So I think we kind of covered. There's no shortage of different pieces and parts, and what you've seen in banking, what you've seen in entertainment, what you've seen in all these other industries. Expect some model of that to come into healthcare. As it sort of lags behind some of these other places. And I think that's going to be an encouraging part for the industry in the future.
All right, and you certainly see that catching up, in your opinion, and in
yeah,
your experience?
I think healthcare is going to be 20% of the national GDP very soon, and the dollars are there to force us to adopt things that have already been developed that we demand to. Because it's clearly a financial priority for everyone to make this thing work better.
For sure. Awesome. Well, Austin, again, appreciate your time. I know you're a busy guy, so once again, thanks for hopping on the show. You're always welcome back. Hope you know that, and we'll be in touch. Any kind of last words here?
No, I enjoyed being on here. Look forward to being back.
Awesome. Cool. Well, We'll see you soon.
All right. Thank you.